Welcome. In this Nclex Mastery session, you'll tackle 50 of the most difficult questions on pediatric congenital heart defects, focusing on cyanotic versus acyanotic lesions. These questions are designed to strengthen your clinical reasoning, improve your ability to recognize key assessment findings, and help you confidently choose the best answer on exam day. Grab a notebook, think like the Nclex, and let's get started. Question 1. A 2-month-old infant is admitted with poor weight gain, tachypnea during feeding, and frequent diaphoresis. The parents report that each feeding lasts nearly an hour because the infant tires easily. On assessment, the nurse notes a loud holosystolic murmur at the lower left sternal border, mild hepatomegaly, and bilateral crackles. Echocardiography confirms a large ventricular septal defect, VSD. While preparing the plan of care, the nurse identifies the priority physiological problem responsible for this infant's symptoms. Which explanation best describes the underlying pathophysiology? A. Right ventricular outflow obstruction reduces pulmonary blood flow, producing chronic hypoxemia. B. Obstruction of systemic blood flow causes decreased perfusion to the lower extremities. C. Blood flows from the left ventricle to the right ventricle, increasing pulmonary circulation and eventually causing heart failure. D. Oxygen-poor blood bypasses the lungs through right-to-left shunting, causing severe cyanosis. Answer. C. Blood flows from the left ventricle to the right ventricle, increasing pulmonary circulation and eventually causing heart failure. Rationale. A large VSD is an acyanotic congenital heart defect characterized by left-to-right shunting because left ventricular pressure exceeds right ventricular pressure. The increased pulmonary blood flow overloads the lungs and left heart, leading to tachypnea, poor feeding, diaphoresis, hepatomegaly, and congestive heart failure. Cyanosis is usually absent unless pulmonary hypertension later causes AIIMS syndrome. Question 2. A 6-year-old child with unrepaired tetralogy of Fallot suddenly becomes extremely cyanotic while playing. The child begins squatting without being instructed and appears less distressed after several minutes. The parents ask the nurse why this position helps. Which explanation is most accurate? A. Squatting increases systemic vascular resistance, reducing right-to-left shunting and improving pulmonary blood flow. B. Squatting immediately lowers pulmonary artery pressure and eliminates the ventricular septal defect. C. Squatting decreases venous return to the heart, reducing cardiac workload. D. Squatting closes the patent foramen ovale, preventing deoxygenated blood from entering systemic circulation. Answer. A. Squatting increases systemic vascular resistance, reducing right-to-left shunting and improving pulmonary blood flow. Rationale. Children with tetralogy of Fallot often instinctively squat during hypercyanotic TET spells. Squatting increases systemic vascular resistance, decreasing right-to-left shunting across the VSD and directing more blood into the pulmonary circulation for oxygenation. This improves oxygen saturation and relieves cyanosis. Question 3. A newborn is diagnosed with complete transposition of the great arteries, TGA. Despite receiving 100% oxygen saturation remains critically low. The neonatologist prescribes a continuous prostaglandin E infusion while preparing for definitive treatment. Which assessment finding requires the nurse's immediate attention during the infusion? A. Mild facial flushing. B. Low-grade fever. C. Increased urine output. D. Episodes of apnea requiring stimulation. Answer. D. Episodes of apnea requiring stimulation. Rationale. Prostaglandin E maintains ductal patency, allowing mixing of oxygenated and deoxygenated blood in TGA. However, a significant adverse effect is apnea, especially in neonates. Continuous respiratory monitoring and readiness for ventilatory support are essential because apnea can rapidly become life-threatening. Question 4. A school-age child has a history of an unrepaired atrial septal defect, ASD. During a routine clinic visit, the nurse notes the child has no cyanosis but reports easy fatigability during sports. Cardiac auscultation reveals a fixed split-second heart sound, S2. Which finding best explains the auscultation result? A. Severe obstruction of left ventricular outflow delays aortic valve closure. B. Increased blood flow through the right heart delays closure of the pulmonic valve throughout the respiratory cycle. C. Pulmonary hypertension has reversed blood flow through the atrial septum. D. Left ventricular hypertrophy causes asynchronous closure of both semilunar valves. Answer. B. Increased blood flow through the right heart delays closure of the pulmonic valve throughout the respiratory cycle. Rationale. An ASD causes left-to-right shunting, increasing blood volume in the right atrium and right ventricle. The increased right ventricular stroke volume delays pulmonic valve closure, producing the classic fixed split S2, a hallmark finding in ASD. Question 5. An infant with a moderate patent ductus arteriosus, PDA, is receiving medical management before possible catheter-based closure. Which nursing intervention is most appropriate to reduce the infant's oxygen consumption during hospitalization? A. Schedule frequent rest periods and provide small, high-calorie feedings. B. Encourage prolonged feeding sessions to improve oral intake. C. Stimulate the infant frequently to promote developmental milestones. D. Position the infant flat after every feeding to reduce reflux. Answer. A. Schedule frequent rest periods and provide small, high-calorie feedings. Rationale. Infants with PDA expend significant energy because of increased pulmonary blood flow and heart failure symptoms. Small, high-calorie feedings combined with frequent rest periods reduce oxygen demand while supporting growth. Long feeding sessions increase fatigue, and excessive stimulation raises metabolic requirements. Question 6. A nurse assesses a newborn with suspected coarctation of the aorta. Which assessment finding would most strongly support this diagnosis? A. Continuous machinery murmur with bounding peripheral pulses. B. Equal blood pressure measurements in all extremities. C. Strong brachial pulses with weak femoral pulses and lower blood pressure in the legs. D. Marked cyanosis that worsens with crying despite normal femoral pulses. Answer. C. Strong brachial pulses with weak femoral pulses and lower blood pressure in the legs. Rationale. Coarctation of the aorta causes narrowing of the descending aorta, reducing blood flow distal to the obstruction. The classic findings include higher blood pressure in the upper extremities, diminished or delayed femoral pulses, and lower blood pressure in the legs. Question 7. A newborn is diagnosed with truncus arteriosus after echocardiography. The nurse understands that this defect causes early heart failure because A. Pulmonary blood flow is completely absent after birth. B. A single great vessel supplies both the systemic and pulmonary circulations, causing excessive pulmonary blood flow. C. The pulmonary valve is absent, preventing right ventricular contraction. D. Systemic venous return bypasses the lungs completely. Answer. B. A single great vessel supplies both the systemic and pulmonary circulations, causing excessive pulmonary blood flow. Rationale. In truncus arteriosus, one common arterial trunk arises from the heart and supplies both circulations. Because pulmonary vascular resistance falls after birth, excessive blood is directed to the lungs, resulting in pulmonary overcirculation, heart failure, and poor weight gain if untreated. Question 8. A 4-day-old infant with hypoplastic left heart syndrome, HLHS, suddenly develops weak pulses, poor perfusion, metabolic acidosis, and profound hypotension after spontaneous closure of the ductus arteriosus. Which intervention should the nurse anticipate first? A. Administer intravenous furosemide. B. Prepare the infant for immediate oral feeding. C. Begin high-dose corticosteroid therapy. D. Initiate prostaglandin E infusion to reopen and maintain ductal patency. Answer. D. Initiate prostaglandin E infusion to reopen and maintain ductal patency. Rationale. In HLHS, systemic circulation depends on a patent ductus arteriosus. Closure of the ductus leads to circulatory collapse. Prostaglandin E is the priority intervention because it reestablishes systemic blood flow until surgical palliation can be performed. Question 9. The nurse is caring for a child recovering from surgical repair of tetralogy of Fallot. For hours after surgery, the child becomes increasingly restless. Heart rate rises from 110 to 155 beats/min. Urine output falls to 0.4 milliliters per kilogram per hour, and blood pressure decreases. Which complication should the nurse suspect first? A. Acute pulmonary infection. B. Normal postoperative pain response. C. Low cardiac output syndrome requiring immediate intervention. D. Mild fluid overload from intravenous therapy. Answer. C. Low cardiac output syndrome requiring immediate intervention. Rationale. Following pediatric cardiac surgery, tachycardia, hypotension, decreased urine output, and restlessness are classic signs of low cardiac output syndrome. Prompt recognition and intervention are essential to prevent inadequate tissue perfusion and organ injury. Question 10. A nurse is reviewing congenital heart defects with a graduate nurse. Which defect is correctly classified as an acyanotic lesion that primarily causes left-to-right shunting? A. Ventricular septal defect. B. Tetralogy of Fallot. C. Tricuspid atresia. D. Transposition of the great arteries. Answer. A. Ventricular septal defect. Rationale. A ventricular septal defect is the most common congenital heart defect and is classified as an acyanotic lesion. Blood moves from the high-pressure left ventricle to the lower-pressure right ventricle, increasing pulmonary blood flow. In contrast, tetralogy of Fallot, tricuspid atresia, and transposition of the great arteries are cyanotic defects characterized by right-to-left shunting or parallel circulation. Question 11. A full-term newborn develops central cyanosis within the first hour after birth. The infant has minimal respiratory distress despite an oxygen saturation of 68%. A chest radiograph is unremarkable, and administration of 100% oxygen fails to improve the oxygen saturation. Echocardiography confirms total anomalous pulmonary venous return, TAPVR, with pulmonary venous obstruction. Which nursing intervention is the highest priority while preparing the infant for emergency surgery? A. Delay surgery until pulmonary edema improves with diuretics. B. Maintain adequate oxygenation, establish for access, and closely monitor for worsening respiratory distress and perfusion. C. Restrict intravenous fluids to minimize pulmonary blood flow. D. Place the infant in the Trendelenburg position to improve venous return. Answer. B. Maintain adequate oxygenation, establish for access, and closely monitor for worsening respiratory distress and perfusion. Rationale. Obstructed TAPVR is a critical congenital heart defect requiring emergency surgical repair. The priority is to support oxygenation, maintain perfusion, establish reliable for access, and closely monitor for rapid deterioration. Delaying surgery significantly increases mortality, and Trendelenburg positioning offers no benefit. Question 12. A 5-month-old infant with a large ventricular septal defect is admitted for worsening congestive heart failure despite optimal medical therapy. During assessment, the nurse notices increasing tachypnea, diaphoresis during feeding, and failure to gain weight over the past month. Which finding most strongly suggests the child should be evaluated for early surgical repair? A. Presence of a grade 2 systolic murmur. B. Oxygen saturation of 97% on room air. C. Mild fatigue after vigorous crying. D. Persistent heart failure symptoms with poor growth despite medical management. Answer. D. Persistent heart failure symptoms with poor growth despite medical management. Rationale. Large VSDs causing persistent heart failure and failure to thrive despite medications often require surgical closure to prevent irreversible pulmonary vascular disease. The decision is based more on symptoms and growth failure than on murmur intensity. Question 13. A nurse is caring for an infant receiving digoxin for heart failure secondary to a congenital heart defect. Before administering the medication, the apical heart rate is 82 beats/min after a full minute of auscultation. What is the nurse's best action? A. Withhold the medication and notify the healthcare provider. B. Administer the medication because the heart rate is within the expected range. C. Give half the prescribed dose and reassess in 1 hour. D. Administer the medication after feeding the infant. Answer. A. Withhold the medication and notify the healthcare provider. Rationale. For infants, digoxin is generally withheld if the apical heart rate is below 90 to 100 beats/min, depending on institutional policy. Bradycardia may indicate digoxin toxicity or increase the risk of adverse effects. The nurse should withhold the dose and notify the provider. Question 14. A 7-year-old child with an unrepaired patent ductus arteriosus, PDA, presents with new-onset cyanosis of the lower extremities while the upper extremities remain pink. The cardiologist suspects AIIMS syndrome. Which explanation best accounts for this assessment finding? A. Complete obstruction of pulmonary blood flow. B. Increased left-to-right shunting into the pulmonary artery. C. Pulmonary hypertension has reversed the shunt, causing deoxygenated blood to enter the descending aorta through the ductus arteriosus. D. Closure of the ductus arteriosus has reduced systemic blood flow. Answer: C. Pulmonary hypertension has reversed the shunt, causing deoxygenated blood to enter the descending aorta through the ductus arteriosus. Rationale: long-standing PDA may lead to pulmonary hypertension and reversal of blood flow, right-to-left shunt. Because the ductus joins the descending aorta, cyanosis may be more pronounced in the lower extremities, a phenomenon known as differential cyanosis. Question 15. A toddler with tetralogy of Fallot suddenly develops a hypercyanotic spell while crying after a painful procedure. The nurse places the child in the knee-chest position and administers oxygen. The child remains severely cyanotic and increasingly agitated. Which provider prescription should the nurse anticipate next? A. Intravenous furosemide. B. Oral acetaminophen. C. Rapid infusion of sodium bicarbonate as the first intervention. D. Intravenous morphine to reduce infundibular spasm and oxygen demand. Answer: D. Intravenous morphine to reduce infundibular spasm and oxygen demand. Rationale: if initial interventions fail, morphine is commonly administered to decrease agitation, reduce oxygen consumption, and relieve right ventricular outflow tract spasm during a TET spell. Additional therapies may include fluids, vasopressors, or beta blockers if needed. Question 16. A nurse is teaching the parents of a child with coarctation of the aorta who recently underwent surgical repair. Which parental statement indicates correct understanding of long-term follow-up? A. Our child will need regular blood pressure monitoring because hypertension may persist even after surgery. B. Once surgery is completed, no further cardiac follow-up is necessary. C. The repaired area cannot become narrow again. D. Physical activity will always be permanently restricted. Answer: A. Our child will need regular blood pressure monitoring because hypertension may persist even after surgery. Rationale: children who undergo repair of coarctation require lifelong follow-up because persistent hypertension, recoarctation, or aneurysm formation may occur. Regular blood pressure assessment in both upper and lower extremities remains important. Question 17. A neonate with pulmonary atresia is receiving a continuous prostaglandin E infusion while awaiting surgery. Which nursing assessment finding indicates the medication is achieving its intended effect? A. Closure of the ductus arteriosus. B. Development of a louder cardiac murmur. C. Improved systemic oxygen saturation and peripheral perfusion. D. Significant decrease in urine output. Answer: C. Improved systemic oxygen saturation and peripheral perfusion. Rationale: pulmonary atresia depends on a patent ductus arteriosus for pulmonary blood flow. Prostaglandin E maintains ductal patency, allowing blood to reach the lungs for oxygenation, thereby improving oxygen saturation and tissue perfusion. Question 18. A 10-year-old child with a history of repaired congenital heart disease is scheduled for a dental extraction. The nurse reviews the medical record before the procedure. Which nursing action is most appropriate? A. Determine whether the child requires prophylactic antibiotics based on the cardiac diagnosis and current guidelines. B. Restrict oral fluids for 24 hours before the procedure. C. Administer aspirin before the extraction. D. Encourage vigorous tooth brushing immediately after the procedure. Answer: A. Determine whether the child requires prophylactic antibiotics based on the cardiac diagnosis and current guidelines. Rationale: some children with congenital heart disease remain at increased risk for infective endocarditis and may require antibiotic prophylaxis before certain dental procedures. The need depends on the specific cardiac condition and current recommendations. Question 19. A nurse is assessing a newborn with abstain anomaly. Which assessment finding is most consistent with this congenital heart defect? A. bounding peripheral pulses, and a continuous machinery murmur. B. Downward displacement of the tricuspid valve resulting in tricuspid regurgitation and cyanosis. C. Narrowing of the descending aorta causing weak femoral pulses. D. Left ventricular outflow obstruction causing severe hypertension. Answer. B. Downward displacement of the tricuspid valve resulting in tricuspid regurgitation and cyanosis. Rationale. Ebstein anomaly is characterized by apical displacement of the tricuspid valve, causing tricuspid regurgitation, right atrial enlargement, and varying degrees of cyanosis due to associated right-to-left shunting. Question 20. A nurse is caring for an infant with hypoplastic left heart syndrome, HLHS, receiving prostaglandin E. Which assessment finding requires the most immediate nursing intervention? A. Heart rate of 148 beats/min while crying. B. Oxygen saturation of 82%, consistent with the infant's baseline. C. Mild flushing after starting the infusion. D. Respiratory pauses with decreasing oxygen saturation. Answer. D. Respiratory pauses with decreasing oxygen saturation. Rationale. The most serious adverse effect of prostaglandin E is apnea. Any respiratory pauses accompanied by falling oxygen saturation require immediate intervention because neonates may rapidly develop respiratory failure. Question 21. A 2-day-old newborn develops severe central cyanosis shortly after the ductus arteriosus begins to close. Echocardiography confirms tricuspid atresia with a restrictive atrial septal defect. While preparing for transfer to a pediatric cardiac center, which nursing intervention is the highest priority? A. Initiate prostaglandin E as prescribed to maintain ductal patency and support pulmonary blood flow. B. Administer a rapid 4 bolus of furosemide. C. Position the infant in Trendelenburg to improve oxygenation. D. Restrict fluids to reduce right atrial pressure. Answer. A. Initiate prostaglandin E as prescribed to maintain ductal patency and support pulmonary blood flow. Rationale. In tricuspid atresia, pulmonary blood flow often depends on a patent ductus arteriosus. Prostaglandin E maintains ductal patency until definitive intervention. Diuretics, Trendelenburg positioning, or fluid restriction do not address the underlying reduction in pulmonary blood flow. Question 22. A 4-month-old infant with a large atrial septal defect, ASD, is admitted for evaluation. During assessment, the nurse anticipates which hemodynamic change? A. Decreased pulmonary blood flow with chronic cyanosis. B. Right-to-left shunting causing clubbing of the fingers. C. Increased blood flow through the right atrium and right ventricle due to left-to-right shunting. D. Obstruction of blood flow from the left ventricle into the aorta. Answer. C. Increased blood flow through the right atrium and right ventricle due to left-to-right shunting. Rationale. ASDs cause blood to move from the higher pressure left atrium into the right atrium. This left-to-right shunt increases right-sided cardiac volume and pulmonary blood flow, producing the characteristic fixed split S2 and possible exercise intolerance if the defect is large. Question 23. A newborn with persistent truncus arteriosus develops worsening tachypnea and hepatomegaly over the first week of life. The nurse understands that these findings primarily result from A. Complete absence of pulmonary blood flow. B. Severe obstruction of systemic circulation. C. Right ventricular outflow obstruction. D. Excessive pulmonary blood flow leading to congestive heart failure as pulmonary vascular resistance falls. Answer. D. Excessive pulmonary blood flow leading to congestive heart failure as pulmonary vascular resistance falls. Rationale. As pulmonary vascular resistance decreases after birth, a large portion of cardiac output flows into the lungs through the common arterial trunk. This causes pulmonary overcirculation, volume overload, and early congestive heart failure. Question 24. A child with an unrepaired tetralogy of Fallot suddenly develops a hypercyanotic spell while crying. The nurse immediately places the child in the knee-chest position and administers oxygen. The child remains restless and cyanotic. Which nursing action should occur next? A. Encourage oral fluids. B. Minimize stimulation while preparing to administer prescribed morphine. C. Lay the child flat to improve venous return. D. Begin chest compressions immediately. Answer. B. Minimize stimulation while preparing to administer prescribed morphine. Rationale. After positioning and oxygen, reducing agitation is essential because crying increases oxygen demand and worsens right-to-left shunting. Morphine helps relieve infundibular spasm and decreases oxygen consumption. Oral fluids and supine positioning are not appropriate during an acute TET spell. Question 25. A 5-year-old child with coarctation of the aorta is being discharged after successful repair. Which parental statement indicates the need for additional teaching? A. Will attend all scheduled cardiology appointments. B. Will have our child's blood pressure checked regularly. C. Since the narrowing has been repaired, lifelong follow-up is no longer necessary. D. Will report leg pain or unusual fatigue to the healthcare provider. Answer. C. Since the narrowing has been repaired, lifelong follow-up is no longer necessary. Rationale. Even after successful repair, patients require lifelong cardiology follow-up because recoarctation, persistent hypertension, and aneurysm formation may develop years later. Question 26. A newborn with transposition of the great arteries, TGA, undergoes a balloon atrial septostomy before definitive surgical repair. Which is the primary purpose of this procedure? A. Create a larger opening between the atria to improve mixing of oxygenated and deoxygenated blood. B. Close the ventricular septal defect. C. Reduce pulmonary vascular resistance. D. Prevent closure of the ductus arteriosus. Answer. A. Create a larger opening between the atria to improve mixing of oxygenated and deoxygenated blood. Rationale. Balloon atrial septostomy enlarges the atrial communication, allowing better mixing of blood between the parallel circulations in TGA. This improves systemic oxygenation until an arterial switch procedure can be performed. Question 27. An infant with patent ductus arteriosus, PDA, is prescribed indomethacin. Which assessment finding would require the nurse to notify the healthcare provider before administering the medication? A. Respiratory rate of 42 breaths/min. B. Grade 3 continuous murmur. C. Weight gain of 120 g this week. D. Urine output of 0.4 milliliters per kilogram per hour over the past 8 hours. Answer. D. Urine output of 0.4 milliliters per kilogram per hour over the past 8 hours. Rationale. Indomethacin can reduce renal perfusion and is used cautiously in infants with decreased urine output. Oliguria should be reported before administration because renal function may worsen. Question 28. A school-age child with an unrepaired ventricular septal defect has increasing dyspnea, digital clubbing, and resting cyanosis. Which complication does the nurse suspect? A. Pulmonary stenosis. B. Eisenmenger syndrome caused by reversal of the shunt. C. Infective endocarditis. D. Acute rheumatic fever. Answer. B. Eisenmenger syndrome caused by reversal of the shunt. Rationale. Chronic pulmonary overcirculation may lead to pulmonary hypertension. Once pulmonary pressure exceeds systemic pressure, the shunt reverses from right to left, resulting in cyanosis, clubbing, and Eisenmenger syndrome. Question 29. A nurse is preparing to discharge the parents of an infant with congestive heart failure secondary to a congenital heart defect. Which instruction should the nurse include regarding home feedings? A. Offer small, frequent feedings and stop if the infant becomes excessively fatigued or diaphoretic. B. Feed every 6 hours to allow longer periods of rest. C. Encourage rapid feeding to finish within 5 minutes. D. Dilute the formula to reduce cardiac workload. Answer. A. Offer small, frequent feedings and stop if the infant becomes excessively fatigued or diaphoretic. Rationale. Infants with heart failure tire easily during feeding. Small, frequent, calorie-dense feedings help meet nutritional needs while minimizing oxygen consumption and fatigue. Question 30. A nurse is reviewing congenital heart defects with a group of newly hired pediatric nurses. Which defect is most commonly associated with diminished femoral pulses? A. Tetralogy of Fallot. B. Patent ductus arteriosus. C. Coarctation of the aorta. D. Atrial septal defect. Answer. C. Coarctation of the aorta. Rationale. Coarctation of the aorta causes narrowing distal to the vessels supplying the upper extremities. As a result, brachial pulses are stronger than femoral pulses, and blood pressure is typically higher in the arms than in the legs. Question 31. A 6-month-old infant is admitted with poor feeding, tachypnea, and recurrent lower respiratory tract infections. Echocardiography reveals a complete atrioventricular septal defect, AVSD. During multidisciplinary rounds, the nurse explains to the parents why early surgical repair is recommended. Which explanation is most accurate? A. Surgery is performed primarily to eliminate the cardiac murmur. B. Repair is delayed until adolescence because the defect usually closes spontaneously. C. Surgery is needed only if cyanosis develops. D. Early repair prevents irreversible pulmonary vascular disease caused by prolonged left to right shunting. Answer: D. Early repair prevents irreversible pulmonary vascular disease caused by prolonged left to right shunting. Rationale: a complete AVSD produces significant left to right shunting, increasing pulmonary blood flow and causing congestive heart failure. Without timely repair, prolonged pulmonary overcirculation can lead to pulmonary hypertension and irreversible pulmonary vascular disease, Eisenmenger syndrome. Question 32. A nurse is assessing a newborn with tetralogy of Fallot. Which assessment finding is most consistent with this diagnosis? A. Bounding pulses with a continuous machinery murmur. B. Harsh systolic murmur accompanied by central cyanosis and decreased pulmonary blood flow. C. Wide pulse pressure with warm extremities. D. Strong femoral pulses and hypertension in the lower extremities. Answer: B. Harsh systolic murmur accompanied by central cyanosis and decreased pulmonary blood flow. Rationale: tetralogy of Fallot consists of pulmonary stenosis, ventricular septal defect, overriding aorta, and right ventricular hypertrophy. Pulmonary stenosis limits pulmonary blood flow, resulting in cyanosis and a harsh systolic murmur. Question 33. A newborn with hypoplastic left heart syndrome, HLHS, suddenly develops cool extremities, prolonged capillary refill, weak peripheral pulses, and increasing metabolic acidosis after the prostaglandin infusion is accidentally interrupted. Which action should the nurse take first? A. Administer intravenous furosemide. B. Obtain a repeat echocardiogram before notifying the provider. C. Restart the prostaglandin infusion immediately and notify the healthcare provider. D. Place the infant in a knee-chest position. Answer: C. Restart the prostaglandin infusion immediately and notify the healthcare provider. Rationale: HLHS depends on a patent ductus arteriosus for systemic blood flow. Interrupting prostaglandin allows ductal closure, causing rapid circulatory collapse. Restoring prostaglandin infusion is the priority while notifying the provider. Question 34. A nurse is preparing discharge teaching for the parents of a toddler with an unrepaired ventricular septal defect who has mild heart failure. Which instruction should the nurse include? A. Allow frequent rest periods during feeding and activity to decrease oxygen demand. B. Encourage unrestricted strenuous play to improve cardiac function. C. Limit all fluid intake unless the child becomes dehydrated. D. Discontinue medications whenever symptoms improve. Answer: A. Allow frequent rest periods during feeding and activity to decrease oxygen demand. Rationale: children with heart failure fatigue easily because of increased cardiac workload. Frequent rest periods and energy conservation help reduce oxygen consumption while supporting growth and normal development. Question 35. A school-age child with coarctation of the aorta reports headaches and occasional nosebleeds. Which assessment finding would the nurse expect? A. Continuous machinery murmur and bounding femoral pulses. B. Elevated blood pressure in the arms with diminished blood pressure in the legs. C. Severe cyanosis with oxygen saturation below 75%. D. Fixed split-second heart sound. Answer: B. Elevated blood pressure in the arms with diminished blood pressure in the legs. Rationale: the obstruction and coarctation causes hypertension proximal to the narrowing and reduced perfusion distally. Headaches and epistaxis often result from upper body hypertension. Question 36. A 2-day-old newborn with transposition of the great arteries is scheduled for an arterial switch procedure. Which statement best describes the goal of this surgery? A. Increase right ventricular muscle mass. B. Close the ductus arteriosus permanently. C. Reduce pulmonary artery pressure. D. Restore normal anatomical connections between the ventricles and the great arteries. Answer: D. Restore normal anatomical connections between the ventricles and the great arteries. Rationale: the arterial switch operation reconnects the aorta to the left ventricle and the pulmonary artery to the right ventricle, restoring normal circulation and eliminating the parallel circulatory pattern seen in TGA. Question 37. A nurse is caring for an infant recovering from patent ductus arteriosus, PDA, ligation. Which assessment finding indicates the procedure has been successful? A. Reduced respiratory effort and improved tolerance of feedings over the next 24 to 48 hours. B. Development of increasing cyanosis. C. Markedly diminished upper extremity pulses. D. Persistent wide pulse pressure with worsening heart failure. Answer: A. Reduced respiratory effort and improved tolerance of feedings over the next 24 to 48 hours. Rationale: successful closure of a PDA decreases pulmonary overcirculation and cardiac workload. As pulmonary congestion improves, infants typically demonstrate easier breathing and better feeding tolerance. Question 38. A nurse is evaluating a child with suspected infective endocarditis following repair of a congenital heart defect. Which assessment finding should raise the nurse's suspicion? A. Intermittent leg cramps after exercise. B. Blood pressure difference between the arms and legs. C. Persistent fever accompanied by a new or changing heart murmur. D. Mild bradycardia during sleep. Answer: C. Persistent fever accompanied by a new or changing heart murmur. Rationale: children with congenital heart disease are at increased risk for infective endocarditis. Persistent fever with a new or changing murmur warrants prompt evaluation and blood cultures. Question 39. A nurse is caring for a newborn with critical pulmonary stenosis. The infant becomes increasingly cyanotic as the ductus arteriosus begins to close. Which medication should the nurse anticipate administering? A. Digoxin. B. Indomethacin. C. Furosemide. D. Prostaglandin E to maintain ductal patency until intervention. Answer: D. Prostaglandin E to maintain ductal patency until intervention. Rationale: critical pulmonary stenosis may require ductal blood flow to maintain pulmonary perfusion. Prostaglandin E keeps the ductus arteriosus open until balloon valvuloplasty or surgery can be performed. Question 40. A nurse compares congenital heart defects during an educational session. Which condition is most likely to present with differential cyanosis, in which the lower extremities are more cyanotic than the upper extremities after pulmonary hypertension develops? A. Tetralogy of Fallot. B. Patent ductus arteriosus with AIIMS physiology. C. Tricuspid atresia. D. Total anomalous pulmonary venous return. Answer: B. Patent ductus arteriosus with AIIMS physiology. Rationale: in long-standing PDA, pulmonary hypertension can reverse blood flow through the ductus, right to left. Because the ductus joins the descending aorta, deoxygenated blood preferentially enters the lower body, causing differential cyanosis. Question 41. A nurse is caring for a 3-month-old infant with a large ventricular septal defect, VSD, who is receiving furosemide, digoxin, and fortified formula. The infant's weight has increased appropriately over the past month, respiratory rate has decreased, and feeding time has shortened from 45 minutes to 20 minutes. Which assessment finding best indicates that the current treatment plan is effective? A. The infant completes feedings with less fatigue and demonstrates steady weight gain. B. A louder holosystolic murmur is heard during auscultation. C. Oxygen saturation decreases from 98% to 90% during sleep. D. The liver remains enlarged despite therapy. Answer: A. The infant completes feedings with less fatigue and demonstrates steady weight gain. Rationale: improved feeding tolerance, appropriate weight gain, and decreased respiratory effort are strong indicators that heart failure associated with a large VSD is improving. Murmur intensity is not a reliable indicator of clinical improvement, and worsening oxygenation or persistent hepatomegaly suggests continued cardiac dysfunction. Question 42. A 7-year-old child with tetralogy of Fallot asks the nurse why they often become tired and blue while running with friends. Which explanation by the nurse is most accurate? A. Your heart pumps too much blood to your lungs during exercise. B. Your lungs temporarily stop exchanging oxygen while you run. C. Less blood reaches your lungs for oxygen during activity, so your body receives blood with less oxygen. D. Your heart rate becomes too slow during exercise. Answer. C. Less blood reaches your lungs for oxygen during activity, so your body receives blood with less oxygen. Rationale. Tetralogy of Fallot causes right-to-left shunting, which worsens during activity, because increased oxygen demand and right ventricular outflow obstruction reduce pulmonary blood flow. As a result, more deoxygenated blood enters the systemic circulation, producing fatigue and cyanosis. Question 43. A newborn with critical coarctation of the aorta develops weak femoral pulses, severe metabolic acidosis, and poor urine output after spontaneous closure of the ductus arteriosus. Which nursing action is the priority? A. Administer intravenous indomethacin. B. Begin prostaglandin E infusion as prescribed to reopen the ductus arteriosus. C. Encourage oral feedings every 2 hours. D. Administer high-dose diuretics immediately. Answer. B. Begin prostaglandin E infusion as prescribed to reopen the ductus arteriosus. Rationale. In critical coarctation, systemic perfusion may depend on a patent ductus arteriosus. Prostaglandin E restores ductal patency, improving blood flow to the lower body until surgical repair can be performed. Question 44. A 9-month-old infant is evaluated for persistent cyanosis. Echocardiography confirms tricuspid atresia. Which finding is most consistent with this diagnosis? A. Continuous machinery murmur with bounding pulses. B. Fixed split S2 due to increased right ventricular volume. C. Left ventricular outflow obstruction causing upper extremity hypertension. D. Absence of the tricuspid valve requiring intracardiac communication for survival. Answer. D. Absence of the tricuspid valve requiring intracardiac communication for survival. Rationale. Tricuspid atresia is characterized by complete absence of the tricuspid valve. Survival depends on blood passing through an atrial septal defect, ventricular septal defect, and/or patent ductus arteriosus to reach the pulmonary circulation. Question 45. A nurse is reinforcing discharge teaching for the parents of an infant with repaired tetralogy of Fallot. Which parental statement indicates correct understanding? A. We'll contact the healthcare provider if our child develops increasing fatigue, cyanosis, or difficulty breathing. B. Cardiology follow-up is unnecessary because the defect has been repaired. C. Our child should permanently avoid all physical activity. D. Routine childhood immunizations should be delayed indefinitely. Answer. A. We'll contact the healthcare provider if our child develops increasing fatigue, cyanosis, or difficulty breathing. Rationale. Even after successful repair, children require ongoing follow-up. Parents should recognize symptoms suggesting residual defects, arrhythmias, or heart failure. Routine immunizations continue according to schedule unless contraindicated for another reason. Question 46. A nurse is reviewing the pathophysiology of congenital heart defects with nursing students. Which congenital heart defect is classified as an obstructive acyanotic lesion? A. Tetralogy of Fallot. B. Tricuspid atresia. C. Coarctation of the aorta. D. Transposition of the great arteries. Answer. C. Coarctation of the aorta. Rationale. Acyanotic congenital heart defects include left-to-right shunts, ASD, VSD, PDA, and obstructive lesions, coarctation of the aorta, aortic stenosis, pulmonary stenosis. Coarctation restricts systemic blood flow without producing primary right-to-left shunting. Question 47. A neonate with hypoplastic left heart syndrome, HLHS, is awaiting stage I Norwood palliation. Which nursing assessment finding requires immediate intervention? A. Oxygen saturation maintained between 75% and 85%. B. Mild tachypnea while sleeping. C. Capillary refill of 2 seconds. D. Sudden loss of peripheral pulses with profound hypotension. Answer. D. sudden loss of peripheral pulses with profound hypotension. Rationale: HLHS is ductal dependent for systemic circulation. Sudden hypotension and loss of pulses indicate severe reduction in systemic perfusion and possible ductal closure, requiring immediate intervention. Question 48. A nurse is assessing an infant following surgical closure of a patent ductus arteriosus, PDA. Which finding best indicates that the surgery successfully reduced pulmonary overcirculation? A. Oxygen saturation remains unchanged at 99%. B. Respiratory rate decreases and feeding endurance improves over the next several days. C. A continuous machinery murmur becomes louder. D. Bounding peripheral pulses become more pronounced. Answer: B. Respiratory rate decreases and feeding endurance improves over the next several days. Rationale: successful PDA closure decreases pulmonary blood flow and cardiac workload. Clinical improvement is reflected by easier breathing, improved feeding tolerance, and better weight gain. Question 49. A nurse is reviewing congenital heart defects before administering medications. Which infant is at the greatest risk for developing congestive heart failure because of excessive pulmonary blood flow? A. An infant with isolated pulmonary stenosis. B. An infant with tetralogy of Fallot. C. An infant with a large ventricular septal defect. D. An infant with critical pulmonary atresia. Answer: C. An infant with a large ventricular septal defect. Rationale: a large VSD creates a significant left-to-right shunt, increasing pulmonary blood flow and placing the infant at high risk for congestive heart failure. Cyanotic lesions with decreased pulmonary blood flow are less likely to present initially with pulmonary overcirculation. Question 50. A pediatric nurse is teaching newly hired staff how to distinguish cyanotic from acyanotic congenital heart defects. Which statement demonstrates the best understanding? A. Cyanotic defects usually involve right-to-left shunting or inadequate pulmonary blood flow, whereas acyanotic defects commonly involve left-to-right shunting or obstructive lesions. B. All cyanotic defects eventually become acyanotic after infancy. C. Acyanotic defects never result in pulmonary hypertension. D. Cyanosis occurs only in children with tetralogy of Fallot. Answer: A. Cyanotic defects usually involve right-to-left shunting or inadequate pulmonary blood flow, whereas acyanotic defects commonly involve left-to-right shunting or obstructive lesions. Rationale: the fundamental distinction is based on blood flow physiology. Cyanotic defects generally result in deoxygenated blood entering the systemic circulation through right-to-left shunting or markedly reduced pulmonary blood flow. Acyanotic defects usually involve left-to-right shunts or obstructive lesions, although long-standing left-to-right shunts may eventually progress to AIIMS syndrome and become cyanotic. Excellent work completing all 50 questions. Congenital heart defects are a high-yield NCLEX topic, and mastering the differences between cyanotic and acyanotic lesions will make prioritization and clinical decision-making much easier. If there were any questions you missed, review the rationales and identify why the correct answer was the best choice. Consistent practice is the key to NCLEX success. Keep studying, stay confident, and I'll see you in the next challenge.